Hello, I'm Dr. Calvo from Cheatham County Animal Clinic, and today I'm going to go over a couple of questions that we usually get from our owners regarding dental care in our dogs and cats. It's February, which is Pet Dental Month, so we're just going to kind of go over some of those facts that we know off the top of our heads. As far as the first question that we usually get, so what's the incidence of dental disease in our dogs and cats? So unfortunately, it's quite high. We usually see about 80% of dogs and 70% of cats having some form of dental disease by the age of 3. It's a very young age, so that's why we like to see them when they're young to start out with our dental care before it gets worse. So another question we get is, what are some of the diseases that they can get later down the road if they're not treated as far as their mouth goes? So with your mouth, if there's a lot of bacteria that builds up, that can go elsewhere to the body. So sometimes we see liver disease, sometimes we see kidney disease, and then finally sometimes we see heart disease associated with a very bad dental medical issue. As far as prevention at home, so a lot of owners ask, okay, can I start brushing at home or can I give them a chew? Is that going to help? Well, unfortunately, we've got to get that plaque, that tartar, that gingivitis under control with scaling. That plaque and tartar, it's just like cement. It is not going to come off with just brushing alone. So get them in for a dental, and then after that, we can start talking about prevention at home. So the single most effective thing for prevention in between dental scalings from your vet would be brushing. A lot of owners can't do that, but we can certainly show you how. There's plenty of informative videos out there, and you can do it in dogs as well as cats. The main thing is making a routine and also having treats or some form of praise after they're done getting their teeth brushed. It makes it go a long way as far as them liking it. Other things that you can try would be water additives as well as treats. But I would talk to your vet about which treats would be appropriate. There's so many out there these days. Trying to find one that's actually effective can be difficult. So contacting your veterinarian, kind of discussing what would be best for your dog or your cat would be good advice to follow. As far as anesthesia, a lot of our owners do not like the idea of anesthesia in our pets when it comes to getting a dental. Unfortunately, your dog or cat doesn't know how to open wide when we ask them to. So it can be very stressful if we're trying to scale the teeth while they're awake. And a lot of times, owners think about the non-anesthetic dentals that they hear about, and unfortunately, I do not recommend those. Like I said, it can be stressful. A lot of things can be missed while they're awake because you can't really probe below the gum line or take radiographs. Or other things would be polishing the teeth effectively after scaling them. So those are things that we kind of think about when we're doing anesthesia on your pet. The other thing that you need to consider is they are monitored the entire time they are under. The other thing is we work them up beforehand to find out if there's any other medical condition before we put them under anesthesia. So pre-anesthetic blood work, if we have to do anything else as far as diagnostics, we do that before we even put them under. So those are just little things to kind of put your mind at ease. And then as far as cost, that's always an issue. That's always something even I think about when I'm getting my pet done for dental. Recent studies have said that the cost of just dental prevention is about, I want to say it's about 1/3 the average cost of treating dental disease. And that was done by a recent study by VPI Pet Insurance. So if you ever want to look up that article, you're more than welcome to. So that's about all I have as far as any type of dental questions that we commonly get. But if you have further questions or concerns, or you actually want to schedule a visit with us, you can call the office at 615-792-4829. I hope this was informative.